and Health Plus Clinic, Al Emirat Hospital Abu Dhabi, and Moorfields Eye Hospital Abu Dhabi. So today it's a very interesting session where we're going to talk about the connection between oral health and overall health. And we are very pleased to have Dr. Batul Aidi, who will be talking to us. Before we start the session, I just want to give a few guidelines for the session as always. This is an online session, so I would request all of you to be on mute and throughout the session so that the speaker can go on uninterrupted. Also, if you have any questions, any concerns, anything you'd like to ask Dr. Batul, whether it's related to the topic or even otherwise, please feel free to put it in the chat box and we will address all those questions towards the end of the session after Dr. Batul has finished with her presentation. There will be a link posted in the chat box in the beginning, that's right now. So if you look at your chat box, there will be a link posted there, which is for a pre-lecture assessment. This is to assess the baseline knowledge of the participants, and it is a requirement by DOH for us to assess that. At the end, in the last few minutes of the session, there will be another link posted in the chat box. This will be for a post-lecture assessment and also for an evaluation of the CME, how it was conducted and how you felt about it. Any suggestions about the CME are also most welcome at that point. So please make sure you've completed all the 3 surveys. This is essential for us to arrange for your certificates. The certificates will finally be issued by DOH, but we will help you facilitate that, and we will talk more about it towards the end. So again, once again, just keep yourself on mute, enjoy the session, and if you have any questions, please keep posting them in the chat box, and Dr. Batul will be very happy to answer them in the end. So now let's start on this session about the connection between oral and overall health and well-being. Dr. Batul Aidi is our dentist at Health Plus Family Clinic at Al Bandar, Al Saadiyat, and at Forsan. She has more than 7 years of experience and has done her Doctor of Dental Surgery from Syria in 2014 and then her MSc from King's College London, UK in 2018. She has also then got the Diploma of Membership of Joint Dental Faculties from the Royal College of Surgeons, UK, and is now practicing with a keen interest in restorative dentistry, including endodontics, pediatric dentistry, emergency dentistry, aesthetic dentistry, and dental research, and has a very kind and gentle approach to her patients, putting their mind at ease and giving them the healthiest smile. And today she's here to talk to us about the connection between oral and overall health. So over to you, Dr. Batul. Dr. Batul, are you there?
Sorry, Dr. Neha, my microphone was muted.
Welcome, and thus over to you.
Yeah, sorry, Dr. Neha, it was muted. Thank you very much for the introduction, and good morning, everyone. Thank you for attending this presentation. I will talk today about the connection between the oral and overall health. It's a very broad topic, but I will try to simplify it as much as I can. Okay, shall we start? So the learning objectives today from this presentation is to highlight the importance of the oral health and its connection to the systemic health, and we will discuss examples of oral manifestations and also the effect of the oral health on the whole body. We will talk about the bidirectional relationship between the oral health and the overall well-being. We will talk about the importance of keeping good oral health and the methods of doing that. I'll talk about periodontitis, and we will discuss the oral health awareness. We will do that by going through the following topics. We'll discuss examples of oral and maxillofacial problems. And I'll give a brief idea about oral systemic connection. This will be through discussing autoimmune disease and systemic connection. We will discuss also mental health and its connection to oral health. Also, we will talk about periodontitis and its link to cognitive decline, periodontitis and diabetes, and periodontitis and cardiovascular disease. We will talk about prevention methods to prevent periodontal disease and the role of dentists and the physicians. Okay, so what are the common oral and maxillofacial problems that we encounter or see on daily practice as dentists speaking? First of all, and the most common thing, the most common dental problem we see is dental caries, the dental decay. Dental caries is a result of bacterial activity in the mouth. When the bacteria starts its activity in the mouth and the pH of the mouth drops, the acidity is high, so this will cavitate the tooth. It will cause the decay. The decay process is basically demineralization of the enamel and the dental tissue. And this can lead to many other problems that we will discuss later. Another example of problems that we see on daily practice is periodontitis, or what is called gum disease. Gum disease is infection, and it's also inflammation in not only in the gum, but it's also in the tissue surrounding the tooth, including the periodontal ligaments, the bone, the alveolar bone surrounding the tooth also. Another intraoral problem we see is mouth ulcers. Mouth ulcers is also a very broad topic. It can be related to many problems. One of the factors that may cause mouth ulcers, it can be hormonal changes. It can be a side effect of medication. It can be related to stress and other mental health problems. Ulcers can also be due to underlying malignancy. Of course, diagnosis depends on the duration of the ulcer and the shape of the ulcer, the location of the ulcer, and for how long it has been there. We will discuss also teeth loss. This problem we see in the dental clinic in many patients. Teeth loss can be due to many problems as well. It's linked to periodontitis, to dental caries, and we're going to discuss dental erosion. It's one of the most common problems that we see on daily practice, and it's called teeth wear. So teeth wear is basically a loss of the tooth structure. It can be limited to enamel. It can be progressed to be including dentin, and probably we can see the pulp of the tooth if it's severe wear. Another problem that we see in the dental clinic is the temporomandibular joint disorder, and this has many causes. We will talk about it later as well, and this has also effect on the life of the patient, because it can progress to include also myofascial pain, It will affect the life of the patient, masticatory function, and many other. It can progress to many other problems. Maxillofacial problems that we see, but what is the connection between the mouth and the body? Well, it's very important to know that what happens in the mouth, it will not stay in the mouth. It's linked to the body, and it will. We will see that on later slides, which I will, and other topics I will discuss later. It's part of the body, and we can see now it's like a cycle. So the systemic disease, the mental health problems, and autoimmune conditions can reflect on the mouth health, and we can see that in the oral manifestation of these diseases. And also what happens in the mouth of infection, including caries, decay, peritonitis, it will spread to the body through a process of systemic inflammation, and I will explain that later. Of course, this cycle of inflammation from the mouth to the body, it's affected by host immune response. It's also affected by other factors like the disturbance of immune system, the bacteremia, the degree of the systemic inflammation, and other factors that I will explain later. I will start with autoimmune conditions and its link to the oral health. So first we have the example of Sjogren's syndrome. Sjogren's syndrome is a problem of autoimmune system that will affect the salivary glands and the lacrimal glands. This will result in dry eyes, dry mouth, and other problems with secretory glands. So we'll focus more on the dry mouth, which we call xerostomia. Well, this means that saliva is not there anymore or decreased. And it's very important to know that saliva has a crucial effect on as a defense mechanism from dental caries and oral infection. Saliva acts as buffering effect when, as we discussed before, the dental caries is a result of dropping in the pH. Saliva acts as buffering effect to neutralize the pH of the saliva of the oral cavity, which will prevent the dental caries and oral infection. So it's like washing away the bacteria and making the acidity of the oral cavity more to neutral. It's not only the buffering effect, but it also contains antibodies. The antibodies will fight the oral infections. So that's why this explains why patients with xerostomia and dry mouth have more infections, oral infections. This explains what happened with patients who has Sjogren's syndrome. It's important to mention also that in later stages, patients who has Sjogren's syndrome may have raise in the rheumatoid factor, and this will affect the joints, including the temporomandibular joints. So the patient will have TMD, temporomandibular joint disorder, and temporomandibular joint disorder, we may see it with symptoms like joint clicking, limited mouth opening, difficulty chewing food, and pain in the temporomandibular joint. Another systemic problem that we see reflecting on the oral health is a systemic lupus erythematosus. And one of the research papers mentioned, it's published in 2021, and it's mentioned that approximately 1/4 of systemic lupus erythematosus patients have oral lesions, including ulcers, oral infections, or periodontitis. So again, we're talking about periodontitis and oral infections. So as a conclusion, autoimmune conditions and oral health, we see that there is a connection. As a consequence, we see periodontitis, and remember periodontitis because I will talk about it more later. Now, the teeth wear. I explained before the teeth wear or dental erosion. It comes in a form of attrition, abfraction, or erosion, chemical erosion, or abrasion. So it can be due to many reasons. It can be because of bruxism, sleep-related bruxism, or the patient is clenching, or it can be due to dropping in the pH due to gastro acid reflux, or other habits that patient is doing. So basically, as we see here in this picture, the amount of the enamel is reduced. So, and in this picture, we see the pulp of the tooth where we have the blood supply and the nerves of the teeth. So it comes in different forms. Okay. Now, what is the connection between the mental health and the oral health? One of the oral manifestation of a patient who is stressed, have an anxiety or depression is teeth wear. But how can this be linked? I'll discuss this now. For patients who have stress and anxiety or depression, sometimes they have sleep-related bruxism or clenching or any other habit to release the stress. This will result in abrasion or erosion or teeth wear in general. We will see the previous picture that I showed before. This will not only result in teeth wear, but will also result in myofascial pain and temporomandibular joint disorder, because the muscles of the mastication will be working the whole night. So you can imagine how the patient will wake up with myofascial pain, also headache, and joint problems, joint pain. Okay, so this is a link between mental health and oral health. It's very important to refer such patient to psychologist or psychiatrist, or to sort out the underlying mental health problem. So it's not only a dental treatment that we need to do, but also a very, very complicated way to manage this case. Another thing I want to talk about is the medication that the patient is taking because of the mental health problem. When physicians prescribe such medication, they need to know that this medication has side effects. It may cause xerostomia, dry mouth, and dental caries. And as I explained before, the dry mouth may also cause oral infection. So it's very important to refer this patient to the dentist to check regularly how is the oral health. Now, the nutritional deficiencies, it's linked to the oral health, how it's showing on the oral health, and what are the problems underlying. Number one, the vitamin A deficiency. We can see the oral manifestation as we see here in the picture, the angular cheilitis and the fissuring of the lips in this picture. And the defects of, we also on developing teeth, we see defects in dentin and enamel. Vitamin B2 and B3 deficiency, we see it as a manifestation of glossitis. As you see in the picture here, inflamed, red, and beefy tongue. And also patients will complain from burning sensation in the mouth and tongue and lips. Vitamin B12 deficiency or anemia, we will see it as ulcers, angular cheilitis also, or glossitis, and also burning sensation in the mouth. And vitamin C, because it's connected to collagen synthesis, so we can see delayed wound healing when we do extraction procedure or any kind of oral surgery. And also with patients with periodontitis, we see rapidly progressing dental pockets, periodontal pockets formation, and ulcerative gingivitis. And vitamin K, we also realize when we do surgeries, we need to consider and ask if there is any problem, including vitamin K deficiency, because the patient will have prolonged bleeding. So in a nutshell, the nutritional deficiencies we will see it as oral manifestation. And this also includes it can refer to underlying gastrointestinal problems, malabsorption, and other gastrointestinal disease. Now, GERD and dental erosion. As I mentioned about dental erosion before, it's because of dropping in the pH and the acidity that is causing dissolving in the enamel. You see in this picture how the shape of the teeth was and how it became shorter later on. Okay, so because of the reduce of the salivary pH from the normal level to acidic level, this will cause dissolving in the hydroxyapatite crystals in the dental enamel. So again, these patients need to be referred also for a treatment of GERDs and along with the restorative treatment. And in severe cases, it is comprehensive dental restorative treatment. And it will be among stages, and we need to consider recording, keep records of the patient each visit to see how much is the disease progressing and how fast it's progressing, and if it's controlled or not. Of course, I need to mention here that in severe cases, what are the consequences? Patients will lose gradually the facial hair, of course, decrease in the occlusion will cause loss of the vertical occlusal dimension, and this will affect the facial hair and the appearance on long term. Now, the opposite way. If we have periodontal disease and oral infection, what can this cause in the gastrointestinal system? I found this paper published in 2017, and it talks about how periodontal disease can cause pancreatic cancer. So among infectious disorder, periodontal disease can cause teeth loss and can cause as a consequence to pancreatic cancer. And also it has linked to other cancers, but I didn't check this. So we'll talk now about periodontitis. What is periodontitis? So periodontitis is inflammation and it's caused by bacteria. It's not only one type of bacteria, but it's like more than 800 species of bacteria. Of course, this depends on the stage and the severity of the disease and for how long it has been there, on the host immune response, and many factors. The main bacteria that is categorized as, the problematic bacteria is the Prophamorphinus gingivalis. And remember this name because we will mention it later. So I will discuss how periodontitis and how Prophamorphinus gingivalis is connected to cognitive decline, diabetes, and cardiovascular disease. First, I will explain to you the pathogenesis of periodontal disease. So we have here on the left side the healthy condition of periodontum. We see the gingival margin and how it's surrounding the tooth. And we have the cemento-enamel junction, the alveolar bone level, and the periodontal ligament. And now on the right side, you can see the difference. And first, I highlighted this one, the plaque and calculus. And here the problem starts with the bacteria in the plaque and calculus. As a defense mechanism from the body, we see now here in the gum redness, and it's congested with neutrophils, lymphocytes, monocytes, and then we will realize the bone loss resorption. And usually we see this on panoramic x-rays or bite wings or any intraoral x-ray we take in the dental clinic. So it's a very important diagnostic way to see the bone loss, the level of the bone loss in the periodontitis case. So as a consequence, we have dental pocket, we call it periodontal pocket, and it's loss of attachment of the connective tissue in the gum, and this will allow more plaque and more bacteria to accumulate in this area, and it's a cycle of inflammation and bone destruction here. Now this bacteria will not stay in this pocket, but it will enter the blood circulation. So there will be barrier breach, and it will enter the epithelium of the gum, and it will activate the osteoclast. We will have bone resorption, and then all these inflammatory byproducts or pro-inflammatory mediators, the interleukins and tumor necrosis factor, it will enter the blood circulation, and then there will be the systematic problem. So periodontitis didn't start straight away. As you see, it's a process, and it doesn't happen among days. It's something that is a result of long-term inflammation. So first it will be gingivitis, which is gum inflammation, mild gum inflammation. And at stage of gingivitis, it's treatable. But when it progresses to periodontitis, then it will be difficult to manage, and we need to consider many stages of treatments, and it's not only a simple, irreversible thing. Now, I need to mention that in periodontitis, there are many factors that will affect the progress of the disease or their susceptibility. And this we have the genetics, and the environmental factors. So how do you know that this patient has periodontitis? Patient may complain of bleeding gums, bad breath, halitosis, and you can tell when the patient has plaque or calculus, tartar. And when the patient say, oh, okay, I realize that I'm having gaps between my teeth which were not there, they come and they think that they need filling, but we realize that it's the gum receding, leaving gaps. So the teeth will become, to the patient, they will see that the teeth are increasing in length, but it's the gum that is receding. And the more obvious thing is the red or swollen gums and loose teeth in more advanced stages, and bad taste due to pus or infection byproducts, and also dry mouth and burning sensation. Okay, so now this is very interesting and I want to share it with you. It's published in the Journal of Neurobiology of Aging in 2018, and they discussed that tooth loss is associated with accelerated cognitive decline. All right, so cognitive decline or Alzheimer's disease or dementia. How can this be connected to periodontitis or periodontal disease or oral infection? Now, this can be in two ways. The first way is the teeth loss and the consequence of the teeth loss, and the second way is through the blood-brain barrier and through the blood circulation. First, the teeth loss will result in compromised sensory feedback. So elderly patients or patients who lost their teeth, they will have compromised sensory feedback to the brain. It's not completely explained until now how the mechanism happens, but they realized that when the patient lose the mastication function and they lose this sensory feedback to the brain, they realize that they will have cognitive impairments. Not only this, but they realized also that this will compromise the nutritional status, and in a way or another, it will cause also cognitive impairment. Now, surprisingly, with patients who had replacement of the lost teeth, that cognitive decline impairment is less. Now, here in these two papers, I will talk about the other way, which is the blood-brain barrier. If you remember the Prophylaxis gingivalis bacteria that is in periodontitis, so here in these two papers, I talked about the relationship of this type of bacteria and Alzheimer's disease. And this was recently published in 2021, the other one published 2019. How can this bacteria cause cognitive decline or play a role in worsening Alzheimer's disease or dementia? So, okay, so periodontal disease. In periodontal disease, we have bacteria that is causing inflammation. As a result, we will see immunoinflammatory response. We will see antibodies and C-reactive protein. All these inflammatory mediators will enter the blood-brain barrier through the blood circulation. And this will cause microglial activation and immunoinflammatory host response. So we will see increase in the neuroinflammation. We will see a raise in the interleukin-6 tumor necrotic factor and C-reactive protein. This will result in tissue damage and will result in plaque deposition in the brain and neurofibrillary tangles. Of course, this inflammatory response in the periodontum will also cause alveolar bone resorption and, as a consequence, teeth loss. So here we see the clinical signs of the periodontitis also. We see it clinically as alveolar bone loss, teeth loss, and attachment loss, bleeding on probing. And for patients with Alzheimer, we see it's very obvious dementia, memory loss, decline in reasoning. For both periodontitis and Alzheimer's disease, again, it's important to consider the environmental and genetic factors. So in conclusion, the inflammation process and the inflammatory mediators, the bacteria that is causing this inflammation, it will affect the cognitive decline. Again, here it's very clear that there are comorbidities that will have additive effects on the patient with Alzheimer's disease or cognitive decline or who have dementia. We realize that there are common factors, which is diabetes, atherosclerosis, and again, it's important to mention that the environmental factor, including smoking, poor nutrition, and lack of physical activity, is common factors between Alzheimer's disease and periodontitis, gum disease. Now, periodontitis and cognitive decline, what will be the benefits and the effect of periodontal care or periodontal treatment? In a recent study, they found that Alzheimer's disease patient assessment scale, it changed faster in the participants with periodontitis compared to those without periodontitis. And after adjusting, this is after adjusting the baseline age, gender, and baseline other factors. So what are the risks if periodontitis left untreated? What will happen to the patient with dementia or Alzheimer? If periodontitis left untreated, this will result in increasing the inflammation, not only oral inflammation, but again, systemic inflammation, more inflammatory mediators circulating in the blood. So this will result in increasing the neuroinflammation, and this will worsen the condition of patient who has Alzheimer's disease or dementia. And of course, we need to consider the oral hygiene for these patients. How management of the oral hygiene, it will be more difficult. So you imagine it's like a cycle. So it's very important to manage these cases in collaboration between the physician and the dentist. Now, this is a very important topic, and it's very common to see patients with diabetes losing their teeth and having gum disease, gum problems. And as we see the cycle here, again, we're talking about chronic inflammation. And it's very much linked to elevated blood sugar levels, and this will increase the complication of diabetes. So gum disease, again, it's a manifestation and a complication of the high blood sugar levels, and it's a manifestation of diabetes. So it's all connected together. But how can gum disease affect the diabetic patient or the state of diabetes? We'll see this here. This diagram explains the potential mechanism linking periodontitis and diabetes and the impact of periodontal therapy on diabetes control. On the left side, in untreated periodontitis, the bacteria and the bacterial antigens together with pro-inflammatory mediators and cytokines entering the circulation and contributing to the regulation of the systematic inflammatory state. This will result in impaired insulin signaling and increased insulin resistance. And this in turn will lead to elevated HbA1c levels, and this will increase the diabetes complications. So the inflammation is increasing, the levels of blood sugar is increasing, and this will increase the complications of diabetes. Okay, what if we have periodontal treatment? Periodontal treatment will result on the other side in reduction of periodontal inflammation, and this will reduce the levels of circulating bacteria and antigens, and also will reduce the levels of cytokines and inflammatory mediators. This will result in reduction in inflammatory state, leading to improved insulin signaling and reduced insulin resistance. So in conclusion, the improved diabetic control or glycemic control will result in less diabetes complication, and this is because the systemic inflammation is less. Now, can treatment of periodontitis improve patients' health? Okay, now this is the answer in this paper, which was published in 2019. They found that treatment of periodontitis in people with diabetes has shown to result in improved of glycemic control. So after we do periodontal treatment for diabetic patients, we see improvement in diabetic control. So it's not only treating the periodontitis, but it's also the diabetes that we are helping to the patient to treat. Now, I'll talk about the periodontitis and cardiovascular disease, and this is the last disease that is mentioned to periodontitis that we will discuss. This paper was published in the American Heart Association, and it's mentioning the periodontitis link to cardiovascular disease. So they found that there is a link between periodontal disease, gum inflammation, and the bacteria that is causing periodontitis, and linked to the first myocardial infarction of patients with cardiovascular disease. Okay. It's very important to mention that there are common factors between cardiovascular disease and periodontitis. This includes the cholesterol, triglycerides, smoking, high blood pressure, and also the lifestyle of the patient, the activity, the physical activity. All right, so here we'll talk more about the link between periodontitis and cardiovascular disease. So they did further studies, and they found in the study done in Sweden in 2019, they found that individuals with high periodontal pockets are expected to have more plaque in the carotid than patients without periodontal pockets. Now, we'll explain more what is the link between cardiovascular disease and periodontitis. Again, we're talking about inflammation and inflammatory mediators. So due to the dense vascularization of periodontal tissue, in patients with periodontitis will see more bacteria and bacterial metabolic byproducts and inflammatory mediators. These inflammatory mediators and the bacterial byproducts, when entering the bloodstream, it will cause endothelial dysfunction and atherosclerosis. The bacteria and their toxins will have direct impact on the blood vessels, and the inflammatory mediators will also have its effect on the blood vessels. This will help more in the accumulation of the plaque in the carotid or the arteries. Now, very important to mention that C-reactive protein was found to be elevated in patients who have severe periodontitis. And we know that C-reactive protein is also it's a marker for patients who have cardiovascular disease, or by cardiologists, they categorize the risk of the patients according to CRP. Again, periodontitis alone is an independent risk factor contributing to the development of atherosclerotic vascular disease, and the underlying mechanism is systemic inflammation. Now, surprisingly, they found that poor response to periodontal treatments may protect future cardiovascular disease. Okay, what about the successful periodontal therapy? The successful periodontal therapy will arrest the disease progression, the periodontitis, and stabilize the bone level, and it will help with the symptoms of periodontitis. It will dimension the symptoms and lengthen the life expectancy of teeth, and it will help resolve the gum inflammation, reduce the circulating levels of inflammatory molecules, and reduce the incidence of acute cardiovascular disease events. And we found that patients who have good oral health routine has less risk of acute cardiovascular disease. Now, what are the ways that we need to follow to prevent periodontitis, and what are the treatment methods? First thing is reducing the bacteria in the oral cavity, controlling the bacterial activity, and this by good oral hygiene and brushing using chlorhexidine mouthwash. Of course, this is prescribed in specific cases. It's important to mention that stannous fluoride toothpaste has its antibacterial properties. Interdental cleaning is very important, and antimicrobial therapy is needed in some cases of periodontitis. This to be referred to the periodontist specialist, where they have their own techniques. They may indicate they may advise for systemic antibiotic therapy or local antibiotic. Depends on the severity of the case. It's important to mention that regular checkups is very important depending on the severity of the periodontitis. Some cases it can be resolved with scaling and root planning, and some cases needs active periodontal therapy, surgical or non-surgical, to remove the calcareous deposits from the root surface or subgingivally. Now, the role of dentists and physicians is very important to be combined together. So it should be teamwork. Luckily, we have here in Health Plus dental team and medical team to follow up with cases of patients who are medically compromised, patients who have immune disease, systemic disease. It's very important to refer patients who need dental care to the dentist, and of course, educate the patients about the importance of oral health care, the importance of oral hygiene, especially patients who have cardiovascular disease, diabetic patients, immunocompromised patients, and pregnant patients also. Periodontitis also found to cause preterm birth and other complications of pregnancy. It's not only cardiovascular disease, dementia, also patients who have mental health problems, anxiety or depression, or under antipsychotic medication. It's important to encourage these patients to have dental checkups, and also help them to keep following up with both medical and dental doctors. So this is the end of my presentation, and those are the references. And thank you very much for attending. If you have any questions, feel free to put it in the comments.
Very interesting and comprehensive, and for me at least it was a bit of an eye-opener, because you know, we never think of how deeply connected oral health is with so many other systemic conditions, and you know, it's very, very interesting to get an insight into how much it can impact. And I think everybody who's looking after anybody with any of these conditions would benefit from involving a dental checkup, and, you know, involving a dentist, so that there can be improvement in both the oral health as well as, you know, reverse on the systemic illness like you mentioned. So there are a couple of comments and questions. Most people have said that it was a very beneficial presentation and they really enjoyed it and they liked it. There is one question that has come, which is from Aisha. Thank you for the wonderful presentation. Please advise how to manage receding gums in a healthy person.
Sorry, the question.
How to manage receding gums in a healthy person.
In a healthy person, yeah. Okay.
Person, yes.
Yeah. Well, we need to look into the reason why, the underlying cause of the receding gums. Receding gums can sometimes be because of bruxism, clenching. It's not only periodontitis, but we need to look if it's receding healthy gums or receding inflamed gums. If it's receding inflamed gums, what are the reasons? Generally, if it's and it depends on the grade of recession. If it's at very advanced stage of recession, we can, and if it's anterior teeth, we can do soft tissue grafts. If it's posterior teeth, then the success rate of the grafting is less than the anterior region. For these cases, we refer to the periodontist specialist. if it's advanced. But if it's mild, then we will advise the patient to follow ways to control this recession and limit it from progressing. Sorry, Dr. Neha, I can't hear you.
Sorry, I'm on mute, sorry. Yeah, I hope that answers your question, Aisha. And there are some more comments about how the presentation was very comprehensive and informative. And a lot of people have just commented that they really liked your presentation. I have a question, Dr. Batul. We see very often pregnant women coming to our clinic, and they have either some minor dental issues or they haven't done a cleaning for some time. So what is your advice on dental cleaning and dental care and its impact on pregnancy? Because from our perspective, it does have an impact on sometimes even causing, birth weight problems in the baby, small babies, and things like that. So what is your comment on that?
Yeah, true. It has, it's actually another topic, and I wanted to mention more about pregnancy, but it's very, very broad topic, the periodontitis. So it's very much linked also to preterm birth. It may cause preterm birth and babies with small babies with low weight. Again, it's the systemic inflammation that is caused by the bacteria in periodontitis. So the key here is to control this inflammation that is caused by the bacteria, and therefore we need to improve the oral hygiene of the patients, whether a pregnant patient or a patient with immune disease or any patient with who is medically compromised. For pregnancy, it's important to educate the patient that once they are pregnant, it's important to go for checkup and check if they have any plaque on the teeth. They need to do the dental prophylaxis, scaling and polishing to remove the plaque on the teeth. And sometimes it's not only plaque, it's plaque retentive factors on the teeth. So we need to eliminate these factors and educate the patients about the best way to brush their teeth and the right technique to brush, and check if there is any inflammation, because sometimes the inflammation is not only causing periodontitis and systemic inflammation. They come with, pregnancy epaulets, gingivitis, gingival hyperplasia, and also the hormonal factor plays role with the plaque and the bacteria.
A lot of information that I can now give to my patients. So thank you so much for that. And you'll probably be seeing more of our pregnant patients very soon. Also, there's another question from Aisha. She says, thanks, Dr. Batul, but what are the steps for mild receding gums?
Okay, so for mild receding gums, if it's causing any sensitivity for teeth, because of course, when the gum recession will happen, it will expose the roots of the teeth, and the roots of the teeth are very sensitive.
Superseded.
Yeah.
Superseded.
So. Yeah, so because of the recession, some patients will have this sensitivity. So if the patient have mild recession, we will ask, do you have any sensitivity? If they have sensitivity, then we will advise with measures to reduce the sensitivity, including special toothpaste. Also, we will check again the reason for the sensitivity. In stages where it's mild, we don't usually do procedure other than eliminating the plaque retentive factors or the plaque or the calculus, because this is the reason for the recession. But once it's receded, we cannot, it's irreversible. So it's very important we stress on the point that we need to control this recession or the reasons, the factors that is causing the recession, because it's irreversible. And the only way is to gain the gum level is grafting. Sorry, Dr. Neha, I can't hear you again.
Hello, I am unmuted. Can you hear me now?
Yeah.
Can you hear me, Dr. Batul?
Yeah.
So there's another question from Dr. Monica. She says it's a nice presentation, and she wants to know why halitosis increases during the mixed dentition stage.
Okay, very interesting. During mixed dentition stage, well, halitosis is because of many reasons. It could be sometimes not only oral or something related to oral health. It can be sometimes we need to check with the pediatrician or family medicine if the child has problem with the stomach or other health problem. If it's related to the oral health, then it can be because of the teeth exfoliating and the permanent teeth exfoliation and the gum that is surrounding the partially erupted tooth. It can cause like a pocket. So and plaque accumulation more, the position of the primary teeth and the permanent teeth, it will help more with the plaque accumulation. So we need to be with the child at this stage and check how they're brushing and educate the child how to brush correctly, and let the parents be with the child at this stage and help them. Some children, they don't know how to brush, so we shouldn't leave them alone. Again, because of it could be, we need to check the tongue if they have any more plaque accumulation on the tongue as well. Halitosis in general is due to the bacteria. So we need to check where's the source of bacteria.
A couple of questions before we end. So there's just a quick one on, can rough brushing cause receding gums?
Yes, of course. Rough brushing and using hard bristle toothbrush and using wrong technique in brushing, brushing in a way traumatizing the gum can cause receding gums also. So that's why when I see patients with the receding gums, I need to tell them about the brushing technique, the right brushing technique, and again, advice for soft bristle brush.
Last question for today from Judith is, what will happen with the gums if the space between other teeth is not fixed for a long period of time and the gums start paining when eating food, especially nuts or salty food? So is this a problem, and what is the consequence of this?
Okay. So if the recession happened and there is a gap and there's a gum inflammation, we try our best to restore the contour of the tooth to eliminate this gap, but up to the limit that is within the anatomical shape of the tooth. And again, the important thing here in this case is to use the interdental brushes. This way, we will prevent this gap from being bigger or more food accumulation. So it's very, very, very important to use the small interdental brushes, because the normal toothbrush will not reach in between teeth and it will not clean between teeth. Either the floss or the interdental brushes to clean between teeth.
And I'm sure there are more questions, but for any further questions, you can email to Academic Affairs and we will forward that to Dr. Batul. So thank you very much, everybody, for attending. And thank you, Dr. Batul, for this interesting session. Before we end, I just want to tell everybody that for your certificates, you will get an email advising you on how to apply on the DOH website through TAM for all those of you who are licensed under DOH. For those who are not licensed under DOH, they can apply for their certificate directly to Academic Affairs. The email is in the chat box and we will send you a certificate. However, for those under DOH, the certificate that we will send you, even if you ask for it, is not going to suffice. DOH wants a certificate issued by them only. So please follow the instructions in the email and apply on TAM. We will approve your participation and you will get the certificate directly from DOH. So please wait for that email and we will send it to you. So I will just end the session now. We are a little beyond time. Thank you so much, Dr. Batul. And thank you, Anit, Tahira, and Cherry, and the whole marketing team and the academic affairs team for making this happen and making this a success. So last few words, Dr. Batul.
Thank you very much. Thank you, Dr. Neha and Anit, and thank you everyone for attending.
Have a great day, and we'll see you next week for another CME session. Bye-bye.